lagi Anda akan menyaksikan The Big Idea Forum in association with
With over 270 million people spread across an archipelago, Indonesia faces distinctive challenges in delivering adequate healthcare. Remote areas often lack essential facilities, leading to disparities in healthcare access. The ratio of doctors and healthcare workers to the population is insufficient. Many regions face a critical shortage of specialists and professional healthcare providers, affecting the quality of care. Hospitals and clinics in rural and remote areas often suffer from inadequate infrastructure, lack of advanced medical technology, and insufficient supplies. However, there are many opportunities for improvement. Telemedicine and digital health platforms can bridge the gap between urban and rural healthcare services and facilitating remote consultations. Collaborations between the government and the private sector can boost investment in healthcare infrastructure. Empowering local communities through health education and capacity building programs can promote preventive healthcare measures. Necessary programs and transformations include strengthening the national health insurance to cover more services comprehensively while ensuring financial sustainability. Investing in the expansion and modernization of healthcare facilities, particularly in remote regions, is crucial. Good policies are required. Boosting budget allocations for health, ensuring efficient use of funds, and reducing out-of-pocket expenses will enhance access and affordability of healthcare services. Addressing these multifaceted challenges with a holistic approach will be essential in transforming the healthcare landscape and ensuring equitable access to quality health services for all Indonesians. The Big Idea Forum on Finding the Cure for Indonesia's healthcare system is a pivotal platform. It brings together industry leaders, regulators, and experts to strategize and find solutions. By overcoming challenges and leveraging opportunities, together we will chart the path to a healthier, more prosperous Indonesia, ensuring a legacy of well-being for generations to come.
Welcome to the future, where medical treatment has transformed beyond imagination. Personalized medicine ensures that therapies are customized to your unique genetic profile, leading to more effective and faster recoveries. Artificial intelligence and robotics have revolutionized surgery. Complex procedures are now performed with unprecedented precision, minimizing risks and recovery times. Telemedicine and remote monitoring have broken down geographical barriers. Patients receive real-time consultations and continuous health monitoring, no matter where they are. Advanced prosthetics provide enhanced capabilities and regenerative medicine, offering new hope for countless conditions. Nanotechnology enables microscopic robots to deliver drugs precisely where needed and repair cells from within, ushering in a new era of precision medicine. Data-driven healthcare leverages vast amounts of health data to predict, prevent, and treat diseases more effectively. Big data analytics allow for proactive healthcare management. The future of medical treatment is here, transforming lives and creating healthier societies. Join us on this journey towards a better, healthier future.
Ladies and gentlemen, distinguished guests, esteemed panelists and participants, welcome to the Big Idea Forum on Finding the Cure for Indonesia's healthcare system. Now, we'd also like to take this opportunity to thank our partners in making this forum possible. And of course, thank you to all our participants and the audience. And here we have guests from the industry as well as health professionals and also, of course, friends of the Big Idea Forum. And today, we gather to address one of the most pressing issues in our nation, which is ensuring equitable healthcare access for over 270 million Indonesians across thousands of islands. And despite significant progress, Indonesia's healthcare system faces numerous challenges. And our diverse geography complicates healthcare delivery, with remote areas often lacking essential services. Yet, amidst these challenges, there is hope and opportunity. We are, for this forum, privileged to have a distinguished panel of experts with us today and who will share their invaluable insights. Of course, we have Pak Budi Gunadi Sadiking, our Health Minister of Indonesia. Big hands, please, everybody. And we hope that the Minister will provide an overview of the government's efforts and also future plans to enhance healthcare delivery. And we also have Jiro Tominaga. Jiro is from ADB, Asian Development Bank. He is the Country Director for Indonesia. Jiro, big welcome to you. And hopefully you will discuss the role of international organizations in supporting Indonesia's healthcare infrastructure. And we have Suhaila Fabia Hakim Ella. He's a Country Director of Tony Blair Institute for Global Change. And we hope that you'll be sharing with us innovative strategies for healthcare reform. And I'm a great admirer of Dr. Purwati, Head of Stem Cell Research and Development Center from Erlangga University. Doc, welcome to the forum, and we hope you will explore the advancements and potential of medical research and improving healthcare outcomes. And last but not least, Soleh Ayubi, Deputy Chief Executive Officer of Bio Farma Indonesia. Ayub, welcome to the forum, and I hope that Ayub will highlight the importance of pharmaceutical advancements and collaboration in healthcare in Indonesia. And of course, as this is a platform for collaboration, everybody, so there will also be an opportunity for participants in and the audience here, not just to ask questions, but please, share us your views, your comments, or probably feedback, because here we have the regulator, and of course, and what we want to have is a generative discussion. So let's begin our discussion for today, and I'd like to invite you, Pak Budi, our Minister, to set the scene for us on, particularly on where we are in Indonesia when it comes to delivering our healthcare services. What is the roadmap like? What are the policies that are being implemented? And what are the plans for the government to ensure sustainably that we can deliver our healthcare system to everybody, affordably and, of course, easily? Silakan. Pak Budi, the stage is yours.
Yes, thank you, Daisy. Our leaders aspire Indonesia to reach its golden period by 2045. It means that they both believe that Indonesia needs to be a high-income country by then. High-income country means you should have at least 13,800 GNI per capita, which is we are now at 4,800. So we have to increase that by 2.5 times. And during the history of any nations, the biggest chance to breach that barrier happens during the peak of demographic bonus. Because we do have the most populous, productive people at that time. Young age, people that can work, that can produce income. So that's why the income is the highest. And for Indonesia, that will happen in 2030. In the next 6 years. So what I would like to share, the first point is, time is very limited. If our country would like to become high-income country, then the biggest opportunity will happen in the next 6 to 11 years. If we fail, we still can be a high-income country, but the effort will be much more difficult because our population will be aging already. So we make the biggest sins to our children and the children of our children, that mostly they will not become, they will never be in high-income country because of our mistake. Now, how to make the average of Indonesian people have income of 13,800 per annum compared with 4,800? My argument is simple. It's not depend on how rich is your natural resources. It's not depends only on how massive infrastructure you have. But you need a smarter and healthier people. So you can earn more. If you are not smart and you are not healthy, then you will not be able to have 13,800 income per annum. And Indonesia will not become a high-income country. As simple as that. And as a health minister, I will argue that healthy comes first, then smart. The reason why? Because my colleague Minister of Education will start the government program when the children reach the age of 4 or 5. In Ministry of Health, I start the healthcare programs when the children age is -9 months. So when they are still in the mother's womb. Because if we fail to do a proper healthcare intervention and the nutritional level is low, then the children will become stunted. And they will not become smart. So that's why I should argue, so the Minister of Health should come first, then the Minister of Education. So now, the argument is how to make our people healthy. Because if our people are healthy, they can earn more. If they can earn more, then Indonesia can reach and break that high-income country limit in 2030, in the next 6 years. So if you want to become healthy, I've been observing, you see next to you is a Japanese. Japanese is one of the most healthiest populations.
It's an aging population.
They have the most centenarian population, people above 100 years old. Because healthy means you can live longer than the rest. To make people healthy are much more important than to cure sick people. So we need to focus more and prioritize how to make people healthy, rather than not only to cure sick people. You have to focus more to puskesmas and posyandu, not only to the hospitals. You need to put more money and effort to enhance the nurses, the housewife, the cadres, not only the specialists. You need to equip them with the screening and immunization tools, not only an expensive proton beam or, chemotherapy facilities. You need to focus on promotive education, educating them, and preventive. Do massive immunization and screening rather than doing therapeutics. So that is the key. And not many people understand that. And to keep these people healthy, we launched the 6 reform. 6 transformational pillars in national healthcare system. The first 2, transformation in primary care and secondary care. The puskesmas, 10,000, 85,000 puskesmas pembantu, 300,000 posyandu, and the 3,200 hospitals. These 2 pillars talking about transformation in access or healthcare services. The next 3 pillars on healthcare system resilience, healthcare financing system, healthcare human resources systems, are talking about how we reform the healthcare resources. How we establish a complete independent system for healthcare therapeutics tools, diagnostic tools, medicine, so we can be independent and have some resiliency during the next pandemic, like Saleh or IUB. How we redefine the financing system, the BPJS, the rest, so it can be sustainable. How the government will intervene, what are the private sector involvement in financing the overall systems. That is the 4th pillar. And the 5th pillar is how we provide the most critical resources out of those 3. Not only the diagnostic, therapeutics, and vaccine, not only the financing, but the people. So this is the reform that we need to do. And the last one, pillar, we talk about the future of healthcare. The information technology role in healthcare. The biotechnology role in healthcare. So we can leapfrog. Don't just follow the steps, you go from chemical-based medicine, chemia, pharma, we just jump to biosimilar or biotechnology-based medicine like biopharma. We don't use an IT, we use, rubbing instead. Doctors can use stethoscope, my popular debate, but doctors can choose whether they want to use stethoscope to detect, diagnose, or they use ultrasound to diagnose. Doctors can also choose. They want to use stethoscope or CT scan to diagnose, or MRI to diagnose, or, biotech panels, cancer panel to diagnose. So the leapfrog in technology, information technology, will help doctors to better do the two important jobs that they have to do: diagnose and treatment. And diagnose and treatment, information technology will change the way.
Okay, so as we've seen in the package, anything to do with digital transformation is essential. The AI and the robotics will play a very, very big part in how we deal with healthcare. Just very quickly before I turn to the others, prevention is better than cure. That's it's commonsensical. It's cheaper, it's more effective, it's more sustainable. But the fact is, I have to point out that Indonesia, we are one of the unhealthiest countries in the world. Our cases of diabetes is on the rise, and we talk about stunting, but we also, childhood obesity is also on the rise. We are not exercising enough, we are not eating enough nutritional food, and these are things that need to be, resolved now. Quickly question, do we have, when you say we don't have enough doctors, how many do we actually need in order to address these pressing issues now? Because obviously it's not just the medical professions, but also the equipment, the hospitals, the accessibility. For an archipelago like Indonesia, it's very complicated.
Talking about preventive actions, Indonesia is well ahead many countries in the world, because Indonesia started with Lemena, Siwa Besi, the concept of primary care of puskesmas, I think in the late 60s. Just years after that, the Alma Ata conference that talked about primary care preventions happens 5 years or 6 years after that. So historically, Indonesia started first. The problem is when the change of government, Orde Baru, to the democratic government, this concept is gone. That is what I feel is a pity. So that's why I would like to put back the focus on primary care and revitalizing an excellent concept that Indonesia has established before the other country of the world. And this preventive and promotive is very simple. First, you have to educate the people on the healthy lifestyle. That is very important, promotive. In Japan, why they are so successful? Because they insert that into the educations at the primary school. That is what we are replicating now. We create 22 curriculum from Merdeka Belajar, age 4 until 17. So that is what's happening. The education is very important. The second important things in the prevention is immunization and screening. Indonesian and very weak in screening. You can screen nutritional level, stunting, with anthropometry. You can screen the pregnant mother with ultrasound, or you can screen elderly people like us, hypertension, blood sugar, cholesterol level. If you screen them properly, and you understand you're talking about diabetes. Diabetes means your normal blood sugar cannot exceed 200. Or better if you can measure HB105C, HB1AC, below 5.7. I'm not a medical doctor, my apology. But we never screen our people. So what I did, in 10,000 puskesmas, we deploy hematoanalyzer and blood chemical analyzer to be able to measure the glucose level. And now it's all digitalized. We already screened last year 60 million people. And 60 million people. And I'm very depressed when I identify with IDAI, the Pediatricians Association, 9,000 children, so below 16, have HbA1c above 7.
Above 70?
It's diabetes.
That's already diabetes.
If you are a children, that is a potential they have diabetes type 1. So they need to be treated with insulin for the rest of their life, otherwise they die. So this kind of facts appears when we do massive screening. And I can talk about breast cancer, massive screening, whatever it is.
Okay, well, but let's turn to you. I mean, you mentioned Japan as a good example. Jiro, I mean, ADB, and I know that ADB also helped, with giving us some money for at least primary care services. Tell us a little bit, what's your perspective, and how can, we access more in terms of health financing, and as well as, the actual financial aspect of it?
Well, thank you very much. I think let me probably start out by stating the obvious, that health is really the fundamental cornerstone of sustainable growth for any countries, whether it's Japan, whether it's Indonesia. It is the fundamental, it is the source of productivity, it's the source of growth, and it's also the source of happiness. Healthier people tend to be happier. Another sort of stability of the society is also very much dependent on that. When I was listening to Minister Budi, I remember the phrase that I think it was back in 1860s, around that time, first wealth is health. Yeah, I think that is very, very, I agree with that. Wealth is, health is definitely the integral part of the wealth of the nation. So with that, I think from our perspective, just to point out a few, just for the marker for this discussion, looking at Indonesia, I think the video also shows that this is a very difficult circumstances, in a sense that sheer size of the population, sheer size of the country, geographic span. I think, but without, against that backdrop, Indonesia has made a lot of progress in the past several decades, and then that is quite an achievement. You can see that in life expectancy, infant mortality, etc., etc. However, also true that if you compare the status with peer countries, for example, in ASEAN, it is still, there's a gap to be filled, and then efforts needs to be done. Now, I think there are many ways to kind of approach this issue, but let me just highlight 2 points, and one of that is very much related to Mr. Budi just mentioned, is about the constraint on the health service supply side. It is about the number of doctors, number of nurses, midwives, health providing facilities, equipment, etc. You mentioned about how many doctors do we need. I think that's that statistics that I saw is that Indonesia has 0.7 doctor per 1,000 population.
0.7.
WHO recommended the level is 1.0 per 1,000. So there's a catch-up that is needed. The second point is also about the regional disparity. I think the health outcome in one province is very much different, either worse or better in other provinces, and that needs to be also addressed. I think addressing this require a patient and sustainable and constant upgrading or investment, and also upgrading the skills upgrade for the doctors and then others. So it is a very patient work. Unfortunately, there is no magic bullet that you can just shoot to just instantly turn the situation around. However, I think in the case of Indonesia, I think the good news is that the government, under the leadership of Minister Budi, have a very big idea of the health sector transformation agenda. And that is very much visionary and then also ambitious and very, very promising. So in that context, together with other development partners like the World Bank and Islamic Development Bank and AIIB, we're very much honored to be able to be part of supporting the financing, as well as in terms of technical assistance and advisory kind of activities. Now, I think the key now is the implementation. I think we have to make sure that this big idea is implemented effectively, and then that is at least for us in the health sector intervention in Indonesia, for us is the #1 priority for now to help the government implement this idea. I think going forward, I think the issue, the challenge Indonesia will be facing is not going to be any simpler. It is more complex. Yeah. Of course, the lifestyle change, the mix of communicable, non-communicable diseases, the kind of diabetes, etc. Stunting on one side, but diabetes and overweight on the other side. And also the climate change also could have an implication in terms of the natural hazards, the disasters triggered by natural hazards could disrupt the health service provision, but also at the same time the heat wave and then also the increase in vector-borne diseases, etc. that you need to deal with. Of course, also the COVID-19 was not going to be the last pandemic that
Who knows, we might have more pandemics ahead of us, right?
So we have to be prepared. I think, and the prevention, of course, it is very, very important part of it. What I kind of sense, I'm of course not a health doctor or anything, but looking at the sector, there's a very key point seems to be that these issues are very, prevention and others, intersectoral, in a sense that Mr. Budi mentioned about education. That's true. Education for the school kids, but also at the same time medical school and in collaboration with the universities in terms of training doctors as well as coming up with the innovation technology. That's one. For example, the pollution also is also a source of important source of health worsening in any countries. So the collaboration with the environment protection side, with the Ministry of Health also, that is going to be. So I think increasingly tackling the issues of the future, the cross-sectoral, cross-transboundary, and then cross-private sector, public sector, university, etc. Collaboration is probably going to be increasingly important.
But are we on the right track?
I think
Our
so.
policy is good.
We're very happy to be able to, yes, I think so.
The key is implementation, right?
Key is implementation for the big idea. Of course, it's a big endeavor. So I think, so that's why we are also very much excited.
But when you mentioned, Japan as an example of best practice, just very quickly, out of interest, how is Japan doing its healthcare? What are they prioritizing, and how much, and how many doctors, and how much are they putting into their health?
Well, I think I'm not necessarily familiar with how much sort of government spending is being made, etc. But there is a lot of a focus on prevention, which is true. The community-based regulatory checkup on the heart diseases, breast cancer, etc., etc. School education as well, the nutrition type of food that we eat. But at the same time, there are many centenarians. But that generation is very healthy. But the generation that follows, we will see how the health outcome is going to turn out.
Now, Ella, we mentioned we learned a lot from COVID, right? Suddenly everything is all about health, and health suddenly becomes in the foremost. But the other thing is also our dependency on technology for all things in our lives, and one of which is, and the most important, I think, is related to health. So what can you say about, the role of, technology, digital transformation as well, and how do we deal with getting information about diseases and so on?
Yeah, I think to answer this question, let's start with the data. So WHO data shows us that, or tells us that in the last 5 years from 2016 to 2021, the healthcare spending per capita in Indonesia has increased for around 50%. But this is the case for Southeast Asian countries as well. Singapore has increased more than us, 62%. Thailand, 58%. Malaysia, roughly 38–40%. So this is increasing trend in the healthcare spending or healthcare expenditure per capita is on the rise. What that tells us is that the curative, again, the complication about curative treatments cost us money. Whereas the preventive one, that can actually be achieved through digitization. What does digitalization mean? Digitalization means for policymakers to get better, well-informed data in making decisions on whether or not we should treat more, again, diabetics or cancers, or balancing between communicable and non-communicable diseases. That's digitization. We at the Tony Blair Institute, we're helping the Ministry of Health to develop the digital health transformation strategy from 2019 to 2025. We designed the sort of landscape of where digital can play the role in, again, reducing the cost, the spending per capita. I would like to also use this opportunity to applaud Ministry of Health, because the adoption of AI has been existent in our country. I would give example of 3 hospitals that have used AI. In Rumah Sakit Pon Hospital, we have actually used AI in helping to do the brain-related diseases diagnostic. So brain-related diseases like stroke, for example, we have used AI to detect that. So that's one. Second example, in Dharma East Hospital, we have used AI to help detect cancer diagnostics as well. And last but not least, in Padang, Rumah Sakit Jamil, we have used AI to help detect the tuberculosis, the radiology part. So I would like to applaud the efforts from the Ministry of Health to use AI in the effort to reduce the spending per capita, to better use our budget to the preventive care rather than the curative one.
Okay, I'm curious about the data. I mean, we have, you know, over 270, maybe even like 280 million people now. How do you, and what are the challenges in accessing data? What are the patients, you know, where do you get patients' data now? Is it all, you know, because we have so many hospitals around the country, so many health centers. How do you integrate them into something that is useful, that is implementable? I mean, you can have a lot of data, but unless you have the deliverables from this data, it's not going to be much help, right?
A very on-point question, I would say. So 3 parts on that one. When we're talking about healthcare transformations in the broader context, like what Pak Budi has explained earlier, we're talking about the 3A elements, right? The accessibility, availability, and affordability. The root cause of our data is about that as well. The accessibility, the availability, and the affordability. If we can get access to data, that means we need to have the second part. We need to have internet access. Recently, we also helped Ministry of Health to cooperate and collaborate with Starlink to provide digital access in some remote areas, right? To then enable the availability of the data, because then we have access to internet. So that's one. The second part, beyond the technology itself, I think the data agglomeration or the data collection and the data agglomeration, the use of it, is that where the AI comes in. When we're talking about AI, we're not talking about just AI at the moment. We're talking about generative AI, ChatGPT. So that's when we use the AI itself to then enable us to get better data result, right? Last but not least is the human resource. At the end of the day, people always talk about whether AI will replace human, whether AI will create more harms than goods, right, to the people. But at the end of the day, the benefits outweigh the costs. And when the benefits outweigh the cost, it's because of the inputs, the resource, the human resource. So that's the education part that we need to catch up to be able to talk more and to educate more on that generative AI.
Talking about technology, I mean, Dr. Purwati, she has recently, she got commended by the World International Property Organization for her innovations. And you saw the package on the future of medicine, you know, when it's all AIs and robotics and using our DNA and gene and therapy and so on and so forth. Tell us about your innovation, Doc, and also, you know, what is the future, particularly for Indonesia, on issues like stem cell, gene therapy, and, you know, all sorts of things related to these very sophisticated and advanced medical science.
Thank you, Mbak Desi. So as we know, science is always developed, especially in the medical science, to looking for the better thing. So like Pak Budi mentioned, so the invention of the medical is becoming from stethoscope and eyeglass like that. And the development of the science is need by a technology and also research, so that is supporting by the human resources and also funding for the supporting and also the regulatory body from the government like that. So if we talk about the WHO terminology, actually in health innovation technology actually is a new or improved solution with a biotransformative ability to accelerate the positive health improvement. And in here, by linking a three-dimensional demand, supply, and also assessment. As a demand is depending priority of the country, and the supply is what about our preparedness or our readiness to apply of the invention. And the assessment is important to be coming from the incubating to implementing and also sustaining of the project to implementing of the innovation as like that. So if we talk about the healthcare innovation, or innovation, so we can divide from several point of view. For example, from source, we can divide to two, biological and non-biological. So non-biological, like mentioned Pak Budi and Bu Ella, is like EI. EI is widespreading not only in medical but also in many departments. So EI actually in the medical is will help the doctor, and maybe the provider can synthesize the data, and also of robotic. Robotic is help the doctor also, maybe the procedure of the operation, maybe in brain, cardiac, and also oncology, and also abdominal operation, as like that. So the hottest issue in the world, not only in Indonesia until now, from several years ago, now and the future, inshallah, is still stem cell. It's a biological, and their derivatives is like scrotum, exosome, and their engineering. Their engineering can molecular engineering, gene engineering, in here also including gene therapy, and then tissue engineering, in here including also bio 3D printing. So for example, if the patient get a avulsion in the calvaria bone, and there is 2 times 24 hours, we can synthesize the calvaria and then implement it. So, and also the invention of the biological, as like stem cell and dairy derivative and their engineering, will regenerative, we call regenerative medicine, to fight degenerative disease like cardiovascular disease, diabetes mellitus, neurological disease as like Parkinson, stroke, and also for develop of transplantation in here. For the cancer, like Pak Budi have a program to support the vertical hospital in Indonesia with proton beam. And we develop also with for cancer is cell-based therapy. With cell-based therapy, with preventing also, we support in natural killer cell and also dendritic cell, and then also immunotherapy based on monoclonal antibody. And then gene therapy and also genomic also becoming hottest issue now for the diagnostic early in the cancer, and can mapping gene expression with NGS, I think so. And then learning from the COVID-19, so the invention of the vaccine, especially platform with RNA or DNA vaccine, and it's very important, especially in the virus can make a pandemic disease like that.
Okay.
Yeah.
You know, we are. A lot of that is a lot of jargon, Dr. Purwati, but it feels like I'm listening to a lecture from you. But you know, the future medicine is all about, you know, gene therapy using, you know, personalized medicine. Just out of curiosity, where does Indonesia compare, particularly with other countries across the region, when it comes to these innovations? And do we actually have regulations? I mean, I should ask this from Pak Budi. How do you know, innovate and actually implement it, but still within the corridors of the regulations?
Yeah, thank you. So if we talk about the invention and hilirization, there is need a transitional. So transitional is the bridging between bench to bedside. And the transitional will the in here meet collaboration between scientists and then clinical setting, like the doctor, hospital provider, RCU, ethical clearance is theirs. And in here, the hilirization actually need also regulatory body for the, as like a biological invention, like in the stem cell and others, and the derivative and their engineering. In Indonesia, alhamdulillah, from Minister of Health and also Badan POM not losing with another country as like FDA and EMA. So we are similar with other developed country in the innovation of health technology as like that. And then if invention from the idea to realization in the biological setting, from the concept of idea, proof of concept, and the in vitro study, and animal study, and the clinical trial phase 1, phase 2, phase 3, and then the biological is enough. But in the setting of the drug, more little bit longer than biological invention, because I need a post-marketing drug. So I think so the innovation of the biological strategy is very important, and not only, but also in the future, I think so.
Okay, so the key is innovation, and the key that there should be more researchers like this, because all medicine is heading that way. I think this is a good segue for you with biopharma, and I know that, you know, biopharma is a state-owned enterprise, and we should look to biopharma to actually provide, you know, the backbones of all the drugs and all the innovations. Tell us a little bit about what biopharma is doing, and also addressing some of these issues and the needs for, you know, preventive medicine.
Yeah, well, I think, you know, we can a little bit step back, you know, during the pandemic, everybody knows that it's just it's nightmare, you know, it's like to handle healthcare problems in Indonesia, simply because of the geographical challenges, you know, and so on. But I think as a country, we did awesome job, you know, with the leadership from Minister Budi. We did awesome job to tackle the COVID-19 pandemic. But this is, I think, the right moment to move on, right? Yeah, we have to move on from the COVID. There's still many challenges down the road, you know. We have to deal with other pandemics. We have to deal with, you know, you mentioned about diabetes pandemic, you know, kind of pandemic. We still have to deal with, you know, other chronic disease, you know, and obesity and so on, right? Those are the challenges that we face. And I think, you know, Minister Budi and MOH lay out like a very good foundation for us to move on, you know, with the 6 pillars of transformations. Biopharma, you know, the fact that we are state-owned enterprises play 2 important roles. You know, the first one is as agent development, which is kind of the extended arms of the government to run all the programs designed by MOH. But at the same time, we are also business entity, right? We always take a look, you know, from those 2 perspectives. When we do something, we always take a look at the trend, you know, of disease. We call it like disease of concern. And it's always aligned between, you know, WHO, you know, UNICEF, Gavi, MOH, other countries, especially, you know, when at this moment, like, all countries are interconnected, right? Yeah. What happened in one country will easily replicate it to other countries, especially in dealing with the healthcare challenges, right? So at this moment, biopharma has been contributing in national level to in providing 13 of 14 vaccines, you know, that used by MOH in national programs. But at the same time, we're also exporting our product to more than 150 countries. Yeah. Overall, every year, more than 700 million people, kids, globally, using our products. Polio is one of the biggest one. Right? And we keep, you know, developing those kind of vaccines. We just finalizing our R&D pipeline for 2025 and 2050. And of course, you know, we want to focus on the current challenge that faced by many low-medium income countries, including Indonesia, which is mostly communicable disease. We are currently having 28 vaccine R&D pipeline that majority of them, or all of them, should be finished by 2035. So all the communicable disease, we're going to have the vaccine, hopefully. But beyond 2035, and the challenge could be different, right? As outlined by Minister Budi or Jiro. Once the country moving from medium country to high income countries, the burden mostly on the non-communicable disease. You know, it's like we already facing it at this moment, but I think it's getting bigger.
Diseases,
The
the
lifestyle
cardiovascular.
Absolutely. So biopharma also preparing ourselves to enter those arena. You know, as you might heard that a couple of weeks ago, we signed an agreement with Novo Nordisk. That's
for insulin, right?
For insulin, right? That diabetes treatment. And also we are working with multiple parties as well, developing, you know, beyond vaccines and you know, treatment for communicable disease. And I do believe, you know, that's kind of the right directions, you know, from business perspective, from, you know, agent of development perspective. The challenge that we have is it's getting more complex, right? The requirements getting more strict, you know, from regulatory perspective. So that's kind of the thing that we have been doing at biopharma level as a business entity or as kind of extended arm of the government.
So the business model, it's probably you need to change as well, right? I mean, collaboration, you mentioned, that should be the key to how,
absolutely,
you know, we can't do things ourselves without the help of other countries, right?
Yeah. So as you may know, that biopharma used to be Pasteur Institute like 100 years ago, right? So we are part of global networks of Pasteur Institute. I think, you know, that DNA is still intact with us, you know. So collaboration, global collaboration, national collaboration becomes our ways of working. If I remember that the polio vaccines, the biggest product, the blockbuster product that we currently have, we started the collaboration with Japan Polio Research Institute and Beacon. That's like 1985, 1986, right? We need more than 10 years to develop the vaccines. And then also we have some other recent collaboration with Merck, with Novo Nordisk, with, you know, Serum Institute, with Novartis, with Sanofi, you know, basically global partners in the industry area. And sometimes with research institute as well, you know. The COVID-19 vaccines, the Indovac vaccines that I think majority of you got it, you know, it's in part of collaboration between biopharma, Baylor College of Medicine, US, you know, and UNICEF, of course, WHO, PATH, Gates Foundations, you know. So we see in the future, and I think the key is in collaboration. I agree with you, and you know, as you may see that the healthcare challenges that we have, that's too big to be handled by just one organization, one company, or even one country. Right? We need like global, national collaboration to tackle all those kind of challenges.
Okay. Before I go to the audience, let me just raise a point on this affordability. And, you know, we all know when we go to the doctors, you know, everything's so expensive, you know, and maybe, you know, they rather go to our neighboring countries like, you know, Malaysia, you know, to get their medical treatment and so on and so forth. Just give us a sense of, you know, drug prices in Indonesia or equipment and the facilities and so on. How can we create an ecosystem that is affordable, accessible, if everything is just so expensive?
I have several key issues that make me very popular or notorious in social media, you know. I think this will be the next one. This will be the next one. So drug prices, yes, it's indeed Malaysia is cheaper than us, but those are three types of drugs. Generic drugs, actually Indonesia are cheaper than most of the country. So to be fair with the industry, generic drugs, cheap drugs, you know, you can use BPJS to buy it. The second category is branded generic drugs. It is usually produced by the local pharmaceutical companies. These drugs in Indonesia price 160% to 300% higher than Malaysian patented drug. Patented drug is drug produced by the international companies like Pfizer, Novo Nordisk, and the rest. So the third category of drugs is patented drugs. It is an internationally produced medicine. This the Indonesian price is 160% to 400% higher. So the easiest argument is always tax. But I'm an engineer, so I love mathematics. The different tax is VAT is 11%. You know, import tax is 2.5 to 7.5%. So it's very difficult for me to comprehend how come tax, which is the range between 2.5 and 11, can make a difference of price 300% or 500%. So I cannot comprehend with my mathematics. You know. So it must be more than tax, because if it is the
if you
it
can't,
is because
we can't.
tax, it can be only like 30% or 40%, but it's just 400%, 300%. So we do some research. And my conclusion?
What?
Distribution expenses.
Distribution.
Marketing and education expenses.
Well, how many, you know, in terms of percentage, how much does it
200%.
mark up? 200?
40% to 200%, more than the Malaysian, the cost. Marketing, education expenses, distribution expenses, you name it. And I'm about to come back again to the president to expose it. Or that will be another, make me very popular in social media. So.
Okay, well, the whole point of this forum is that we collaborate to find solutions together, not pit one against the other, because at the end of the day, we're all in the same ship, heading to the same direction, and you know, accessibility, affordability, and also quality. Healthcare should be the right of us all. So we have Pak Adib Kumaidi, Chairman of the Executive Board of the Indonesian Doctors Association. ED here, give us your perspective and ask the tough questions here.
Yes, thank you, Desi. First of all, I just want to ask about the philosophy of the medicine. My Minister of Health mentioned about the prevention, mentioned about the curing. But the philosophy of medicine, there are the care and the cure. The care and the cure interdependent aims, because the problem is in the health, especially in Indonesia. There are many problems in healthcare, many problems in the health system. But I just want to systematize with the three problems. The problem in the healthcare service system. Secondly, the problem in the educational system. But the last, then, and it's very important, the problem about the financial system. It is about the budgeting. We know we need the strategy, how to improve about the budget. Because in the regulatory health law, now, it's not any about the mandatory spending. Because it's very important to how to improve the healthcare system in the province, in the city, but now it's not mandatory spending. It is about the price. My Minister of Health about the price and the medicine, but actually the price in healthcare system very expensive in Indonesia. Why? The medicine expensive. The raw material more than 90% in the medicine. Import. And the long distribution chains. It is very related to improve the price in the healthcare. So, if you want to competition with, similar with the Malaysia, how to the best strategy to decrease the price. Because I think
I like the way you're looking at me instead of him. I don't have the answer here.
I meant
Pak Budi is the numbers guy.
Because I think my ministers know the problem, Mr. Budi know about the problem in healthcare. But how to the best strategy, especially to how to decrease the price.
Okay. I think we've got the point, but I would like to ask, we have from International Pharmaceutical Manufacturing Group, Mbak Ani Raharjo, as the Executive Director. I'm sure you have your your thoughts on this issue.
Thank you, Ibu Desi and Pak Menteri. So first of all, thank you as well for the transformation that has been significantly changed the landscape of healthcare in Indonesia under your leadership. So my question is, as we are now in the transition of the new government, so what do you think the next administration should do to, one thing is to reduce medical tourism, increase access to innovative medicine, and also to improve the investment climate in Indonesia in the healthcare space. Thank you very much.
Okay, do you want to answer these now, or should we have?
Okay. So about the financing. Pillar number 4, transformation in healthcare financing. In my personal view, as an ex-banker, we have 2 major issues in healthcare financing. Globally, it's not only Indonesia. Number 1, healthcare costs per capita in every country except India in the last 20 years increased higher than GDP per capita. So we have to make sure we have to put a lot of pressure on this healthcare cost increase every year, because otherwise it's unsustainable. Second issue, in United States, the average life is 79 years old. The average American spend 11,000 US. The neighbor Cuba and Panama, the outcome is the same, 79 years old, but they spend only 1,900. 20% of the US they spend. Compared to Japan, they are 84 years old, higher than the US, the outcome, they spend only 4,800. The Singaporean, 84 years old, they spend only 3,300. So you know, this disparity is huge. Why? Because healthcare costs is the most intransparent, asymmetric information globally. You can buy clopidogrel in Indonesia with the price of 100, like example. You go to Malaysia, you have to pay, you pay in Malaysia 100 rupiah, like example. Here in Indonesia, you pay 500. 5 times, 500%. Even in Indonesia, if you go, like example, cesarean or sunat or whatever, cesarean, in small hospitals, in type D, in the cities, remote regencies, you go to the private hospital, the price can be 100 to 150% difference. You go to the private hospital in Jakarta, can be 500% difference. Here in healthcare sector, the information is asymmetric. So,
sorry, the question is why? Why is it not transparent? Why is it? Is it because?
Because it's very controlled.
Very controlled.
Yeah, very controlled by the healthcare providers. So nobody can have the transparency in the price. So that is the reason, as a government, as a regulator, we have to make sure we open the transparency, we open the asymmetrical information, like the price of medicine in Malaysia and Indonesia, so we can use public to pick and choose quality versus price. So that is about pricing. And to do that, I agree, we have to open an opportunity for the international company to invest in Indonesia. And then, talking about medical tourism, why people go to Malaysia, it's not only about price. It's not only about price. It started with the trust of the patient. If people don't trust the doctors, there is no profession called the doctors. No, my feeling from the outside, if people start losing trust and choose another source of information, source of money, source of healthcare services, then you need to be aware and be careful. If it happens in a very rich group of people, it's okay. But when it starts going down to the middle class people, that they prefer to go to another places because they trust that can be treated, then we have to be seriously doing something, do introspections, be a little bit open, don't use deniability, and do internet check. What happened with us? And what can we do to regain the trust of our patient and our people so they can come back to us? I think that is the issue that nobody touched. Why people go to Malaysia? It's not only about money.
Okay, really, from Heartology Cardiovascular Hospital.
Thank you for the opportunity. Mr. Budi, I guess my question would be, many times when top leaders change, agenda also change. And as we transition, I think related to the transition process, what would be the one thing that you hope to get carried on if you serve second time as health minister, or for the next health minister to do? If there was only one thing that can get carried on for the next term, what would it be? And how can we, private hospitals, support the government in accomplishing what the government needs to do?
Okay, thank you. That's a very important question.
So I think Pak Jokowi has done a very great job to answer your questions. You know, the next president will continue his programs. So I believe that will trickle down. So the next minister also most likely will continue the program of the previous minister, whoever he is or she is, whoever he is or she is.
But are you confident that that's going to happen?
I'm confident because it has proven already the leaders are very close to each other. Then they said openly, publicly, that I will continue. So then automatically...
Yeah, they say a lot of things, you know, the government. Key is implementation, right? No, but I think more important is actually, you know, creating the ecosystem and the guardrails to make sure that whoever is in charge, you know, cannot actually change the... you know, without causing a disruption. Is this what you're doing? Are you creating those guardrails?
I'm doing it, I agree with that. But to be honest with you, even in developed country, United States will change leaders. Right? United States, one of the most advanced countries. Leaders play a significant role, I agree with that. Yes, we can put a lot of systems, but leaders can change the system too, right? So that's why I believe, first, what is the most important is see as number one. Number one is the leaders. Because the leader can change things, you know, including change the regulations. You know,
and then they can change after 1 year, right? 2 years. And 10 years later, it's like a completely different country.
But in the system, we are implementing it now, and we are using that. You know, one of the examples, if you have a program tie in internationally in terms of financing, you cannot change the way easily. You know. The bankers will say no.
For us, sustainability, you know, is very important. Certainty, especially if we work together with, you know, foreign partners, you know, is important. So let's hope, you know, whatever good work can continue, and you know, work on the basis of, you know, a long-term vision. We have like 2045. Everybody agrees, you know, the age of the Indonesia emas, you know, but if we have to keep
we don't have that long. We have to do it faster before the demographic bonus vanishes.
Ella, you want to add something?
I think at the implementation level, I like the word implementation there, right? I think at the implementation level, I think one area, if I may chime in here, I think there is the R&D element, the research and development element, that then leads to innovation, that leads to then improve, right?
Yeah, like
that's what Dr. Purwati also mentioned. So what has been done today is that Pak Budi has set up the INA-CRC, the Indonesia Clinical Research Center. You know, I'm not a doctor here, but I think that can lead us to leapfrog, because in 2017, the data that was given during the G20 event, right, in 2020, in 2017, Indonesia only participated in 3% of the global clinical trial that is conducted in the Southeast Asian countries.
3%?
3%.
Wow.
Thailand, 38%, right? What's the importance of this clinical research? It leads to the future, like, vaccine and future preventive medications, right? So what's happening now is that, thanks to, again, the leadership of Minister Budi, we have the Indonesia CRC, and please talk more about it, Pak. Then we're able to then get involved in the global, the Gates MRI, the more clinical trials that can lead to the more innovative medicines, So that's something, the foundation of the future R&D that also can help improve the pricing of the future medicine. So please share that.
Yeah.
This topic is fundamentally extremely important for the country, but not as popular in social media like the stethoscope and the foreign doctors. But we established this clinical research because Indonesia every year only do like, she is from pharmaceutical company, 250 clinical research. And Malaysia do 2,500. This is for the future of medicine, the future of treatment, the future of medical devices. Indonesia is not part of the landscape of this IQVIA or all this research company. The reason why, because our regulatory platform is so lousy, is so old, and we are not supportive at all, you know, for the research.
Our regulatory platform is so lousy.
To be honest, that's why
this is very worrying.
We have to do it, you have to look inward and see what we should reform. If we keep saying that we are good, everything is okay, we are the best, you have to stay hungry, stay foolish, you know, if you want to move forward. So I admit. And that's why I established this clinical research. And now even, you know, the next vaccine for tuberculosis, clinical trial will happen in Indonesia. The DMD gene therapies, very sophisticated from US, will come and do with Sarjito. So start advanced clinical trials will come to the country.
Yeah, and you should support researchers, like, you know, clinical trials is something that you do on a regular basis, like Doc.
I think Ms. Ella is okay in the collaboration in here to Hilarization and development of our R&D system. We call now about a pentahelic. It's academici, business, government, community, and also media. The academici will promote about the science and innovation and the research, and the business is to promote in the Hilarization of the product, and the government will promote in the regulatory body, will make a regulatory for protect the scientists till to clinical setting, hospital, and also the provider and a doctor. And then the community be a consumer, and media is very important also in the publishing of the invention or a new innovation as like that. And then as we know, the invention as like in the stem cell in our experience, so the cost of the stem cell in Indonesia is more cheaper than foreign. So it can also be a medical tourism in Indonesia, Pak Budi. We have many patients from from Turkey, from Mexico, from Japan, from Singapore. No, very many patients come to ask about that innovation in the stem cell, because the regulation in Singapore is not support for stem cell invention, I think so. And in our experience also, as like Pak Budi said, trust to the doctor is important also. Many patients, I ask them, so how you choose us in Indonesia? Yeah, because we trust you, as like that. And the second is a facility, as like the many supporting of the medical equipment, advance, and then also of provider. So in here, all benefit will giving or getting for all stakeholder, I think so, for patient, for payer, and for provider. For patient, the patient will getting high services and high satisfied, and for payer usually can drive down cost for medical long term, and for provider will can give a better their services as like that.
Okay, so you know, those elements are important, and I'm glad to know that in Indonesia is actually our stem cell research is quite far ahead. You know, we're not behind, you know, the other countries. Yes, Alex, short and sweet, please.
Alexander from Digital Transformation Council in Industry. It was a very precise and concise presentation from you, but as I responsible for startup industry, I would like to know what will be the roles of our startups, like I have seen here, Dr. Ines, also Prof. Bayu, in your transformation roadmap. And secondly, as our previous edition, we are talking about digital literacy. So what about the health literacy? Because as again, we don't want no one left behind. Thank you very much.
And I still have one more for anybody wants to ask. Yes? Just very quickly, please.
Thank you for this opportunity. My name is Gede Bayu Suparta from Department of Physics, Universitas Gadjah Mada. I'm a founder of PT Madina Karya Indonesia, developing digital radiography system. I agree with the conclusion that to keep people healthy, we need many investment, many facility, many infrastructure, human resources as well. But however, before the program, we need the data of healthy people. We need the data. And the data is provided by medical checkup. One of the best medical checkup in the world is digital radiography, using X-ray, because it provides visual image of the body. So we can provide that. We can make it. We can develop it. We can manufacture it in Yogyakarta to Indonesia. However, to support that, I asked Mr. Minister of Health to delisted the regulation. One of your regulation is number 24 in 2020. It should be happen in Indonesia, but because of that regulation, digital radiography cannot be provided in a remote area. Thank you.
Thank you. Well, there you go. So, tough questions.
Transformation pillar 6, transformation of healthcare technology. So what we did, first, we are building another 2 population databases. Every country have at least one population databases called the demographic population database. We have Dukcapil, 260 million Indonesian whole population. You have name, address, birth date, sex, etc. Now, starting last year with the new law, opt-out, so mandatory is coming in. If you want to get out, you sign a paper. We are building clinical population database. So we have Desi Anwar, address, birth date, CT scan data, blood sugar data, ultrasound data, MRI data. Is that?
Make sure it doesn't get hacked.
Yes, of course. I'm a banker. I make sure my data is not get hacked. And then we are building the 3rd population database digitally. Desi Anwar, address, birth date, CT scan data, blood sugar level, cholesterol, BRCA1, BRCA2, MGMT, starting this year. With BGSI, where 2 lovely ladies are here that we will cover in the next event. So with 3 population database, mandatory to get in from 3,200 hospitals, 6,000 labs, 12,000 pharmacies, 25,000 primary clinic. The data are coming in. Now I have 2.8 million ultrasound data after we launched for the last 6 months in DICOM. You can do massive artificial intelligence, machine learning, big data analytics that will leapfrog Indonesian capability in healthcare services. On top of that, we develop a regulatory sandbox. We are the 2nd industry after finance that help develop a regulatory sandbox where, startup can come in. We do 3 accelerator program already, where the startup, biotech or infotech can come and compete, and they play within this regulatory sandbox. If they are good, they will get invested. The 3rd thing that I do is my best skill. We invited all my friends in private equity and venture capital that helped me develop a unicorn like Gojek, Tokopedia, Traveloka, East Venture, Alpha GWG, Alpha Venture, Kejora Finance, worked with Temasek, worked with IFC, worked with Legend Capital in China. They established a healthcare fund to help support startup in infotech and biotech. And the fund is already there. Now they will supporting, researcher, entrepreneur like her or like him, as long as they pass their criteria. And this research coming from private sector will accelerate, you know, the development of new products. So that is what we have done, especially on the invention related with healthcare technology.
What about our friend from UGM? We haven't answered.
This one, I don't really understand the
well,
paper, I will answer him.
It's a regulation that doesn't
That regulation
work.
is old, and I see the year it was issued before my time.
Okay.
Yeah? That is
There
one
you
thing.
go.
The second one, we will promote X-ray because why? X-ray sometimes it's better than stethoscope to identify, you know, certain diseases, right? To identify certain diseases, and we deploy X-ray now at 514 cities, digital. DICOM format. We do start with some research with one AI company to do analysis, to analyze 120 diagnoses from chest X-ray. And we are working now with the Indonesian Menterian Kesehatan Hospital to do it. So it will be available if you want to access that one. That databases will be open to researcher and any startup in Indonesia.
Yes, sir.
So I think I want to add one more about the role of startup, right? We SOEs, state-owned enterprises, we're operating like corporate models, right? We tend to start everything from scratch by ourselves, but we change the way we're working. So as you may know, that one of the good examples I want to share with you is our collaboration with a startup called Nusantik. Yeah? During the pandemic, I think some of you get, you know, poke the nose to get the PCR test. That kit developed by Nusantik. And then Biopharma role is to provide a manufacturing capacity, manufacturing capability, and then also the distribution capability and so on. So I think there is an opportunity. One thing that we want to make sure is that whatever you do, you know, the startup company, make sure that you follow the guidelines so that it's not far from the industrial standard. You know, most of the time, you know, it's like either research institution, universities, or, you know, startup, they tend to follow some kind of lab standard. When we try to expand like the scale in the industrial standard, the gap is quite huge, right? So you have to understand about the GMP process, GMP standard, you know, all those things. And I think the story of one area in Boston is called Kendall Square. You know, it's like Main Street behind the MIT. You know, that's kind of the center of biologic product development. And we want to copy at some point, you know, that kind of models. And of course, it needs collaboration between the academics, you know, the pentaholic that's proposed by Dr. Purwanti. At the same time, of course, you know, guidance and regulations from the government. The second thing that we want to share with you is that back to you know, the discussion about prevention is cheaper than the cure, right? So I want to give you one of the example that the vaccines. I think that's one of the most success story of prevention medicine, right? You give injections and then you prevent the disease, right? And there's a lot of study, actually statistics. One of them is from Gavi, where me and Mr. Budi is a board of member on that one. Every dollar that you spend in vaccinations, you get $21 back in terms of productivity, avoidable sickness, you know, all those things, right? So there's a lot of story, there's a lot of statistic about prevention is cheaper than curations, and I think, you know, what we need to do is, you know, deploy resources, you know, all efforts, you know, probably in that area first. And I think the guidance, the regulation from the government is very well aligned on that one.
I think we need a whole big idea forum for this, you know, on biogenomics science. Jiro?
I just wanted to make a brief point about the startup support. We are also working with a number of universities in Indonesia to help them with the science and technology part. And one of the university, I think Gajah Mada, we're working with them in terms of they're focusing on the medical and innovation in that area. So we provide innovation fund, etc. So that is also kind of a collaboration between the education side of this and then also the medical side. The other point I just want to come up quickly about the continuity. I think this perspective from our organization like us in terms of development economics and etc. In a strong human capital, the country with strong human capitals grow faster. And I think with the focus on a growth and then also continued prosperity, and that will be sort of transition into the new government as well. I think that is a very kind of common sort of basis for continue to develop on the human capital, and a very important part of that is health.
Yes, absolutely.
So I think there's element of continuity.
And human capital is something that we have a lot of.
In quantity.
In quantity. So we want to get that 13,800 income
per annum
by 2030. Well, I'm afraid that time is short, but we can continue this conversation later when we go out and have coffee. But just very quickly, final remarks, perhaps. Let's start with you, Ella. Just very quickly.
Yeah, in Tony Blair Institute in the UK, we've done a study that preventive medication can help to contribute to 0.3% to GDP growth in the UK. In Indonesia, I believe the number will be higher. We'll do that study, but again, preventive medication, R&D is the investment for the future.
Yes. So just quickly, final remark from you, Jiro.
Yes. The health, again, is a very important part of wealth of the nation. And then, as the ADB, we are very much committed to continue supporting Indonesia's efforts on implementing and then reaching this very ambitious agenda of health transformation.
Dr. Purwati, final remarks from you?
So the invention on innovation is very important, and in the development of the many departments, not only in the medical science.
Okay, Ayub.
So healthcare is everybody's responsibility. I think it's not the responsibility for the government or the minister only. So I think if we believe that whatever the foundation that laid out by Minister Budi and Pak Jokowi is the good thing to carry on, then we have to keep it together. From any perspective, R&D, media, it's like government, all those things. We have to keep it. We have to make sure that it's carry on.
Okay, Pak Budi, final words from you. Reassure us, please. We don't want any lousy regulations or lousy ecosystem.
Every regulator's dreams are wonderfully written in Sustainable Development Goal 3 target to promote healthy life, not to cure sickness, and well-being. So happiness, not only healthy, mental health, not only physical health, to all people. So not only the rich, the poor also, not only the Javanese, but also the Sumatran, and all ages. For young people like Desi, but elderly like me. So, to promote healthy life and well-being for all people and all ages. And that is our job to do.
Okay, and on that note, big hands please to our amazing speakers. But I think when we talk about health, health is wealth, but it's each of our responsibility, right? We should be responsible for our own health. That's why I think the education aspect, the literacy aspect is very, very important. We have to make sure that, we eat right, we exercise, have a good night's sleep. Those, at the end of the day, those are the things that we can do to make ourselves healthy. Otherwise, it's very expensive for everybody, very expensive for our BPJS. If we just end up having to cure people. So, once again, thank you very much. And as we conclude today's forum, I would like to also extend my deepest gratitude to our distinguished panelists for sharing their invaluable insights and expertise. And throughout our discussions, we've seen that we have identified key areas that require our collective focus: improving healthcare infrastructure, expanding the healthcare workforce, and also enhancing our national health insurance, and also leveraging digital health technologies. And these are not merely goals, but essential steps towards ensuring that every Indonesian has access to quality healthcare. Thank you once again to our speakers, Pak Budi, Ella, Jiro, Dr. Purwati, and Ayub. And also thank you for your participation, and of course engagement and collaboration is key to producing good policies. Let us leave here today inspired and determined to make a lasting impact on Indonesia's healthcare landscape. Thank you, and see you in the next Big Idea Forum. Bye-bye.
Anda baru saja menyaksikan The Big Idea Forum in association with